Welcome back, everybody. Time once again for another talk with Dr. Trinh, the only health talk that tries to make sense of the noise and cut through the clutter. Find out what you're really thinking and what we're really doing these days. Never does that seem more important than right now this morning here as we approach the 4th of July. We thought we'd be independent here from COVID and some of these concerns. Instead, we're going backwards. Dr. Trinh, what's going on here?
It is, it seems worse now than it did, several months ago, March, April, when we were panicking over this and being shut at home and sheltering at home, and fear was high. We're actually worse now, if you looked at the numbers.
Yeah. Talk about that, because they say that we're actually at a higher hospitalization. Is it rate or utilization? Explain what we're looking at. Somehow it's worse than it was a couple months ago.
Yes, the number of patients with coronavirus is the highest it's ever been for at least certain states that are now affected, including California, Texas, and I think Arizona,
Florida, yeah, right.
Yes,
all the big states, right?
There's a good number of states that are just...
New York says, we don't want those Californians here. You stay home. If you want to come home, New York, forget it here. We don't need you, or Texans, or any of these other people here.
I don't think the New Yorkers want us right now.
No, exactly.
They're
right.
doing better.
They're doing better. So how did we get here, and how do we cut through the noise? Because I'm getting lots of static, confusion again here, as I'm sure many of your listeners are going to talk about this morning. I don't know what to believe. I saw something the other day, just to give you, I may play a little bit of it here. In fact, I think I will. I'll find it. This wasn't from some right-wing blog. This was from some left-wing blog, actually a vegan activist, a doctor back in Ohio, and she's saying, folks, this is just the flu. It's overblown. Get back out there, take off the stupid masks, and just live with it. It's the flu.
Yes, and that's
left and right.
Yeah, and that's probably why our numbers are increasing.
I look at what happened here in California. They said, okay, come back out of your hole, safely distance, wear your masks, and we'll let you all back out. And people went crazy. They stopped social distancing. They stopped wearing the mask. They defiantly, the health officer here in Orange County got quit because she was getting death threats for suggesting that people wear masks. I mean, people were so violently against this. Not all of us. Many of us complied. But most of us just seemed to feel like, okay, phew, we dodged that bullet, and they're still firing at us.
So Vicky on Facebook has a good question. Okay. She says, could it be that we're testing more?
Yes, that
seems to be that we are testing more.
So in other words, that nothing has changed. It's just that we're getting more efficient at finding out who's got it. We're simply finding more cases. It's not that the cases are going up. We're just getting better at finding them.
Yes. So Vicky, the number of cases going up is contributed by the higher number of testing. But the other thing we look at is the number of positivity cases within the test that we do.
Explain that, because that confuses me too here.
Yes. So what that means is, if I test 100 patients, how many of them are positive for COVID, right? So if 3 months ago I test 100 patients and 3 out of 100 tested positive, that's a 3% positivity rate, right? 3 out of 100. If today I tested 100 patients and 6 or 7 out of 100 tested positive, then the positivity percentage increases, there which means there's a lot more patients walking around with this than before. So you break it down to not the total number of testing that you're doing. You could be testing another 5,000 a day, 10,000 a day, 20,000 a day. But what you break down is what percentage of that testing that is done is positive. And that tells you how more prevalent this is in the community, as opposed to just an absolute number of higher testing, and we're finding more patients with it. Right? Do you see the difference? Do you see the difference?
I guess what you're saying is that testing, it doesn't matter how many people you test. It's how many people, as you randomly test people or as you regularly test people, as people walk in and say, I want to test, either because they think they got it or you just want to test people. How many of those, what percentage of those people turn out to have it? And that percentage seems to be higher.
Because you could be testing a lot more people, but if the percentage drops, then that's not a bad thing, right?
Right.
So you could be testing a lot more people, but if the percentage of positivity drops, then that's not a bad thing. It means the virus load is going down, among the population.
Right.
But if that percentage rises, then that's not a good thing. It means more people are walking around with it.
More people are walking around. Now, what do you think? I saw the other day, one of the things we're going to lead up to today here and just touch on, I don't want to go into it because we're going to do a whole show, another show on this at 1 o'clock here today with one of our other shows, The Rad Life. But, are we headed towards the same curve that we did in 1918, which is to say the infection rate goes up and the deaths, there are several spikes and waves to this thing here. It doesn't just hit and go away. And we were all talking about the second wave coming at some time in the fall as this one dies off in the summer. This one doesn't seem to be dying off. In fact, it seems to be accelerating.
I think we're still in the first wave.
Yeah, right.
I think the first wave has never really gone away.
Right. Well, I encourage everybody to tune in. That'll be part 2 to today's discussion here. I don't want to preempt the show we've got coming at 1 o'clock here, but I just want to tease it that if any of you want to hear more about the past, we're going to do a deep dive into the 1918 flu pandemic, the forgotten precursor to this, and even talk a little bit about, is it, there's some talk that maybe there's another swine flu brewing like we had a few years ago, which is what apparently that was in 1918. They're not sure. They didn't have the exact testing back then, but they think it was a swine flu as well. It came from pigs this time. And there's some report out of China, didn't get a lot of play, but saying, we think we see another one percolating over here. So
let us finish the first one first.
Yeah. One at a time, please. One at a time. So
pandemic at a time.
We're not trying to scare people. We're trying to cut through the noise because an awful lot of people right now are dismissing, not governors, but a lot of the public and a lot of the public discourse is dismissing the fact that this is not getting better, that the trend line is going back up again, even as we're still in this first wave here. And one of the explanations was, as Vicki said, it's been the official position, I think, of the current White House. It's just more testing. Don't worry. We're just getting better at testing. We're finding more people. The infection rate isn't changing. It's just we're finding more of them. You're saying the infection rate it's not true. The infection rate itself, according to the data, is going up.
Yes, the percentage of positivity is going up. I'm not even as concerned with the number of new cases, although the numbers look concerning, right? We're like at 50,000 a day of new cases in the United States. Right. It took us like 2 months to get up to 50,000 cases, and now in a day we're at 50,000 cases in new cases, right? Right. What I'm really concerned with is this, and I can only speak for Orange County, right? Which is the data I look at and which is where we live. Orange County has around 670 ICU beds among the 20-something hospitals.
Okay, total.
Yeah. uh, about 670-ish ICU beds. 1 out of 4 bed is taken up by a COVID patient.
Wow.
Now, if that doesn't alarm you, then you're living in a different world, because because we don't have the flu where 1 out of 4 beds in the ICU is taken up by a flu patient, guys. We don't have any disease where 1 out of 4 beds in the ICU is taken up by that bug.
And what's the percentage in like Arizona and Texas? Houston, I hear, is at full capacity. All their ICU beds are currently occupied. Might not all be COVID, but they're all taken. Because what's the typical rate of what's the vacancy rate? Shall we say? We use it like a hotel term. What's the vacancy rate at the IC intensive care units here?
It
What
varies.
capacity did they normally run? 50%,
It's it's very
20%?
seasonal.
Okay.
It's very seasonal because during the flu, and more people are sick with the flu, and the flu flares up another condition like their emphysema or asthma. Obviously, more patients are admitted to the hospital, more ICU beds are taken. So it's very seasonal. Um, we are not at capacity, which is a good thing in Orange County.
Right.
But I can say that 1 out of 4 beds is uh, is a patient with COVID, which concerns me quite a bit, because once you get to the ICU, that's where that's the next step to being a death, a number for COVID death is getting to the ICU.
All right. So let's sketch this out a little further here, just so we're all clear. So if we get to 50%, 100%, 75%, as we start to run out, as we run out of ICU beds, what happens? You come into the hospital and they say, man, you're really bad. We got to put you on a ventilator. We haven't got one.
That's what happened in Italy, where the government was rationing care.
And rationing care, I saw a frightening, this was the former health director for the state of Arizona. He said they're in rationing care right now, or they're close to rationing care.
Really?
I may be wrong on that. They may be. There was another term he gave for it, they're close to making that rationing care thing because their beds are full. And he said the point I was trying to make is, I'm not trying to scare people, but the point I was trying to make is, he said if we get to rationing care, and he said we could, that means we make a decision and we use a chart, we use a numbered kind of chart, we assign numbers to this. And one of it is, how old is the patient? How many more years of productive living do they have versus you? You're younger. You probably got to, we should save you over. We got to decide which one we put our resources into. And that may mean that old Paul, sorry, old Paul, but your time has come.
We'll
We
save you a
normally,
bed, Paul. We'll save you a bed. No
we'd be
worries.
normal. We'd be happy to try and help you in regular times. But Paul, you know what? We got to make a choice, and we got to go with this other one. So good luck. Go home, and God bless you.
And God forbid we ever get to that.
God forbid we
Yeah,
ever get to that where you're choosing who
right,
lives and dies.
right. I am I am just perplexed. Obviously, many of us on Facebook on a regular basis. There are still folks out there who are non-masking type folks on Facebook. Um,
There's an I won't give her I won't shout her out, but there is a professor at Saddleback, associate professor I believe at Saddleback University. She has a website. I sent it to you before. I don't want to give her more
yeah,
publicity here, but she's actively organizing anti-mass protests. Let's talk about one of the other things here. What do you think? We'll ask your audiences: is it safe to wear a mask? How many people? There was that lady, famous lady at a Trader Joe's somewhere, who went off when they said, she says, "I've got a doctor's permission. I have a health condition. My doctor says I can't wear a mask. It's harmful if I could die if I wear a mask. Quit making me put that thing on." And people are trying to get these fake things that say I have a medical waiver, a mask waiver here. Talk about that. Is there such a thing as a mask waiver? Do you ever tell your patients, well, no, Paul, you shouldn't wear a mask. Everybody else should, but please, Paul, don't you wear a mask?
I'm sure there must be a health condition out there where you can't wear a mask, but that is by far an exception than the rule with that.
Do they
I mean,
restrict
I
your
mean,
breathing? Do they make it? Are they keeping the germs and the bad air close to your body here, and you should be expunging this, expelling this, and
you
somehow
know,
if I restrict the air and hold it all
that is the
close,
most that is the most bogus BS argument.
don't hold
If
back.
that
Tell
is
us what you really think here. Yeah,
if that is the case, doctors and nurses who wear masks all day in the hospital must be committing suicide
yeah.
around the world. That's
You
the most
you said
BS
that, and I
argument
thought,
I've ever seen.
why has nobody countered with that argument? I have seen more people on the internet saying, I can't wear a mask. It's harmful to wear a mask. I'm not going to wear a mask because of it. And you say, then if masks are so dangerous, then doctors and nurses should be dying.
They should be dying because we wear them at every hospital in every country of the world. I have, there's no, it's really, yeah, that doesn't even require defense.
But it's part of the people. There are people out there right now that are trying to say, it's not that
Yes.
I don't want to wear a mask, but it's dangerous if I wear. How many of you out there, raise your hands if anybody think it's dangerous? Seriously, I'm not trying to call people out or shame people, but I'm just trying to understand because I don't get it either. But maybe there's something I'm missing here. Maybe
Well,
maybe that argument.
the thing with the internet is you can Google anything to find any position to support you in the in the internet. I can find the Flat Earth Society,
Yes.
right?
Well, we know
Those who
that.
believe in the
I'm
flat
trying to
Earth,
show you that the Earth is not flat here today. Here,
right? But that's the scary thing is that you can take a position, do a Google search on that position, and there will be a website that supports your position. So rather than looking at the data, following the data, and drawing a conclusion based on the data, what many of us do is we stake a position first, and then we only find, based on our internet search, we only find data that we are willing to accept, and because it supports our preconceived position.
there's a term for that. Something bias here, predetermined bias or something like that.
Yeah, and that happens all the time, right?
Yeah.
It's like, let me give you a good example, right? If you are, and so this pandemic is now full of politics, as you can tell. If you're on the left, right, you you view you view every data and you filtered in that data with glasses, right? With glasses that have a left viewpoint. If you are on the right, right? If you're a conservative and you're on the right, every data that comes in is going to be filtered with glasses that filters through conservative values, conservative beliefs, conservative viewpoints. And so we stake our position and we only select the data that we like. And we use only those data to support our position, right?
Right.
So if you're gonna search, if you're gonna do a Google search on how a mask can kill you, I'm sure there's gonna be somebody somewhere on this earth that's gonna have a
I'm gonna do it
statement on
right
that,
now here. Okay.
right?
Danger
Good
of.
morning, Sherry. Good morning, Lawton. Hey, Isabel. Good morning,
So, any
Melissa.
of you guys out there coming on, do any of you feel at all scared of wearing a mask? Do you think there's any danger in wearing it? Forget about whether you want to or whether you need to. That's two other debates. None of us want to. Some of us think we don't need to. It's overblown and fake and forget it. But do any of you in any way, shape, or form feel hesitant, dangerous about wearing a mask? Please let us know. Do any of you feel it's frightening, it's dangerous to wear a
I
mask?
can tell you one thing is sometimes it feels like, especially if the mask is like a heavy mask, not all the masks are the same, right?
Right.
If it's a really heavy mask, sometimes it feels like claustrophobic,
Right.
or sometimes it feels like you can't breathe as well because it's feels claustrophobic. So it's definitely not convenient to wear a mask, right? It's definitely not very convenient to wear a mask, especially when there's a shortage of masks going around and you have to wear the same mask. So I can definitely understand that.
So here's just typed it on the internet. Where is wearing a mask dangerous? And there's a site that came up. Fact check. Does the social meme, the viral meme floating around, suggests that wearing a mask can increase a wearer's chance of carbon dioxide poisoning?
Yeah, if
So I'm just keeping I'm
the
expelling
mask,
carbon dioxide. The carbon dioxide builds up. I get carbon dioxide poisoning or hypoxia.
these masks are very porous, um, where carbon dioxide poisoning isn't something that we have seen. I have seen some cases where there were runners who ran and they were wearing masks, and I heard they died, right? They dropped dead because
Right.
they weren't getting enough oxygen and things of that sort. So I would say nothing's 100%. But obviously, if you're out doing a fast run and you need to breathe, wearing a mask probably isn't a smart thing, right? With that. But in general, we have not seen issues with that. And as Sherry says, we have surgeons doing 12-hour surgeries wearing masks all day, and the entire surgical team has a mask all day. You walk around Memorial Care Hospital like I wasn't this morning, seeing patients and admitting patients, everyone has a mask on the entire shift. So this thing about masks being dangerous and killing you is, if that's true, we would be committing, suicide in the hospital, because mask is mandatory in the hospital at the hospitals we work at. So there's zero science behind that,
Well,
other than folks who are
Snopes.
looking for a reason.
If you've ever looked at the site Snopes, not Snoops, but Snopes, they try and snoop out these rumors running around, and then they try and rate them. I don't know again what they claim to be unbiased here. They say this is mostly false, but the idea was that's floating around is a prolonged use of COVID-19 related face masks can cause health problems due to breathing in too much exhaled carbon dioxide. That's the idea, is that is this dangerous to do? And they say, no, this is mostly false. And the only extreme examples might be if you're extremely breathing very hard like that continuously for a long period of time. But you would know it. You would feel lightheaded. You'd feel dizzy.
Yes,
You wouldn't just drop dead.
right.
You would start to say, "Oh, wait a minute, something's wrong here," and then
Wait a minute, let me take my mask off so I can breathe.
yeah, right. So you would
Right.
clearly have some indication, way,
Yes,
way,
yes,
way before something happened here,
yes.
that you were exhale. It's not
You
like
know
you're
what?
wrapped your mouth around the tailpipe of a car here, and you're trying to
Right.
breathe in too much carbon dioxide here.
So have you seen the number of new cases uh, on a daily basis? Let me see if I can pull up on my cell phone and show it to you guys here. I have a picture of it somewhere.
Vivian
Uh,
said an interesting thing. If you really do have, like, let's say you're taking oxygen, you have, like my uncle years ago had, what's the disease where you can't breathe, your lungs are damaged? Oh,
COPD, emphysema.
emphysema. He had emphysema,
Yes,
right?
yes.
And because he smoked for all those years. So if Vivian says, well, if you really have that, why can't you take both? Why can't you take, you
Mm-hmm.
have your oxygen mask on and it's giving you clean oxygen
Correct.
and that's preventing you from exhaling. Go ahead.
So here you go, guys. Here you go. New cases in the U.S. So obviously that spike, right, in March, which was why we had to shelter in place,
Right.
and then we did good because everyone was sheltering in
Point it out
place.
because I can't tell where March is on there.
Oh, right here. Um, March is March is here, and
Right.
then June is here. Right. This is chronological: March, April, May, June.
So look at June has jumped higher than
Yeah,
March, April.
yeah. So we did well. This is shelter in place. This is what happens
Started to
when
come
we
down,
when we did the right things. And then here
right? We
and
started
then
to
here
reopen.
we reopen. And also here, you know, were protests.
Yeah,
Uh, Also here were all the events that we did unmasked.
right,
Right. I'm not against protesting, guys. I believe in the right of protesting. Wear a mask when you do it.
right.
I've seen so many events where people just don't wear a mask. And so I think it's coming home to roost because you saw the spike at the end. It is opening up society. It is people just being less concerned with coronavirus. It's not that coronavirus has gone away. It's still here, as you can tell, and it's getting worse. But the fear of coronavirus has gone down. And as the fear has gone down, we are less concerned with social distancing. We're less concerned with masking, and even now, as cases are rising, there is still a debate online on Facebook about mask versus no mask. So since we don't have consensus, we're going to continue to have a worsening rise in this epidemic, guys.
So again, I'm going to suggest anybody who's interested in a deep dive on what has come before. It's hard to compare apples and oranges. It's hard to compare last year, 100 years ago, with today. 100 years ago was a very different America. It was less dense. We had less medicine. We had less science. We had less of everything. We had less people. But
Right.
it was scary what happened. And today at 1 o'clock, we're going to be taking a deep dive look at that. If you want to join us again, it's The Rad Life, RAAD, The Rad Life, or you can go here to OC Talk Radio's channel, and we'll be giving you an examination of that aspect. And I only say that because, again, the World Health Organization, whether you trust them or not, has identified that a similar swine flu, we went through the swine flu in what, 2008, 2009 or something, and that's similar to what they think happened in 1918. It was called the Spanish flu just because the Spanish reported it more than anybody else did. The other countries were suppressing it because it's the end of World War I and mostly soldiers were bringing it and transmitting it. Join us at 1 o'clock. We'll talk more about that, the Rad Life today. But what
I have a
happens?
solution. I have
Okay,
a solution for the swine flu.
shoot all the pigs. No, right.
Eat bacon before bacon eats you.
You like bacon. You had that last show where we were talking about bacon
Eat,
here.
eat bacon, turkey bacon, maybe
Turkey
not
thing.
swine.
Yeah, right. All right. So again, I mean, we're living in a tale of two cities. I look outside. Well, it's kind of overcast today, but I don't see the sun is shining. I don't see people dropping dead.
Yes.
I see at stores more and more people accepting it. Not everybody. And I'm stunned at the people who don't. For example,
Right.
tell me. I'd love everybody's opinion. Why are some people wearing masks and others not? And here's the group that shocks me. Older people generally I see wearing masks. I don't see older people walking around there because we're more worried it affects us. We're more likely to get to the point where this can kill us here, right? As we've got more conditions, we're older, we can't fight it as well. So goes the theory. I was at Target last weekend. I had to go get my grandson. He had to have a certain toy. Oh my God, we can't stay home. We've got to go get this toy. All right, so we'll run in and we'll get it. And so they're making a social distance. So they're spreading us out in the line. The stores are doing an excellent job. They're suggesting everybody wear a mask. They're not saying you have to. I don't know why they aren't, but they're saying please do. They'll even hand you one if you need one. And people are saying no thanks. And they just walk in. And there's a woman in front of me who's pregnant. And she has two little kids with her. None of them have masks. Her children don't. She doesn't. She has an unborn child within her. And she's just, going about her day. I can't be bothered with a mask. Now, I don't know whether she just is oblivious or whether she's just thinks I'm young and it doesn't matter, or whether she's defiant. And I wanted to ask her, and I thought, I don't want to start a pissing match here right in Target. I don't want to shame her, but why? You have most women I know, when they're pregnant, my daughter included, go to the extreme of trying to protect anything.
Right.
Is there any danger? I suppose if the mother gets sick, does the baby get sick too? I mean, should pregnant women be particularly worried about this, or because they're young, c'est la vie?
We don't know yet. It's a new virus to us. We don't know. What we do know, what we do know is masks save lives.
Masks save lives. There you go. Masks
Right.
save lives.
But unfortunately, in this time and age, because there are very strong feelings that
Masks make a statement about who you are.
Mac makes a statement about your politics.
Mm-hmm.
There's very strong feelings about the fact that masks will make a statement about government control over you.
Right.
Right.
What tribe you belong to? We're the
What
Bloods
tribe
and the
you
Crips.
belong to.
We're the Bloods and the Crips again. The famous gangs up in East L.A. that one wears red and one wears blue, and they fight at the mere sight. They're like bulls. If they see red and you're a blue, you have to start fighting with the guy here or the person. So I think that has become. And again, I'm not trying to politicize this, but I think everybody could understand if they've ever heard me before. I'm not a fan of the current administration. When the president says people are wearing masks to make a statement about him, I think that's ridiculous. I'm not wearing a mask because I want to say up you. I'm wearing a mask because I'm scared because I'm in my 60s here, and I don't want to take any chances. So why would a young mom, and this isn't the only young person I saw, why would a young mom, I understand this 16-year-olds, forget it, I'm Superman, nothing's going to happen, but a young pregnant woman, what do you guys think about that? Why are people not wearing masks? Is it ignorance? Is it inconvenience? Or is it defiance? Can't tell me what to do. Tell us what you think. Why? And I'll throw another fact in here. I've read, I don't know if this is true or not, that men are less likely to wear a mask than a woman. That it's harder to get, the president says he just doesn't like the look of it, doesn't feel comfortable, thinks it looks silly. Now, the other day, for the first time, he did, to a conservative outlet, he did say, no, I've worn a mask a few times and I kind of look like the Lone Ranger. Maybe it's not so bad. I thought, hooray. Okay. But he still refuses to do it on camera because somehow that's weak, they think. He hasn't said why. But the official position is we suggest wear them and do whatever you feel is comfortable.
Yeah, all I can say is that the virus does not discriminate whether you are pro-Trump, anti-Trump, Republican, Democrat, whatever your political affiliation is, the virus does not discriminate. If you are not keeping an eye on your own health and the health of your loved ones, the virus doesn't care. The virus doesn't care that November 3rd is coming, then there's an election, right? And it really doesn't care. So that's something to keep in mind. The virus doesn't care if this is some government plot or not government plot, because if you catch the virus, it can kill you anyway, with or without the government plot.
Yeah. So listen to some of the comments here
Right.
from some of your guests.
Yeah.
Share. I posed the question, and I really, honestly, I wish we could have a conversation about it. I wish I could have asked that woman without her getting angry and going off on me. And we have another viral video where she's screaming at me or something. I wished I could have done it, but I have my 6-year-old grandson with me. We're trying to stay distant. She's not distancing. Her kids are all over the place, and she's trying to corral them like a typical young mom does. And she's pregnant. She's quite pregnant with her next one, and oblivious to anything about her. So Sherry says ignorance. I think there's a certain amount of people that are just, I can't be bothered with this. I got too many other things to deal with right now.
Isabel says, it seems it is a bit of awe of what you said. Don't tell me what to do. There's no real need. It may be a political choice. Yes, it is all that because I've seen all of that on Facebook, right? I've seen all of that among my friends on Facebook who take, strongly take both sides of the picture. Um, and and all I have to say is that the virus doesn't care.
The
If you catch
virus
it, you're
doesn't
going to
care.
catch it. It doesn't care what your political view is or what your religious beliefs are, or
L-
it's just a virus.
Let me encourage two thoughts here. One is Sherry had a great thought here. She says she carries extras with her. I never thought of that. You could hand them out if
That's
you see
great,
somebody.
Shay.
Yeah, you could say, hey, can I help you? I have an extra mask if you need one. And that way you politely say, maybe you should be wearing a mask there, bud, without saying, I've wondered, should we shame people? Should we say, where's your mask? And then be cranky old people and then have them go, well, I forgot it, or I'm sorry, something. Should we
The
be,
shame's gone both sides. The shame's gone both sides. If you walk around like Laguna Beach,
Mhm.
you may be the only one wearing your mask.
I have felt that sometimes. I put my mask on in business a couple times in the studio here, and I don't know whether I should wear it in the studio or something. And I take it off, and I say, Rebecca, you could take it off in here. And I think, why am
Yeah,
I saying that?
if you're in like Laguna Beach, Newport Beach, you're walking around, hardly anyone has a mask on. So you may be the one shamed for
Yeah,
wearing
right.
a mask.
And I feel stupid. I feel weird. I have felt that a little bit looking around, like people looking at me because I'm wearing a mask. And I say, the heck with it. So carry an extra mask. Should we call people out? Is there a polite way to ask somebody? Somebody else says they have a retail store, and she said a
I,
couple people have come in and said, no, I can't wear a mask.
I love the idea of bringing an extra mask with you, because then you can always offer it to someone who may not have access to a mask.
Mhm.
They may not be wearing a mask just simply because the three masks that they have been used 20 times already,
Right.
right?
And
So
and maybe that's a subtle way to say, hey, I'd really like you to wear a mask, and if
yes,
I'm happy to help you. And then if they say no, I'm not going to wear one or something, you say, okay, right, I offered at
yeah,
least, yeah, right.
I love that idea. And you know what else? And this was um, my wife Jenny brought it up the other day. It's like when you're in countries that mask up, right? And I'm talking about Southeast Asia,
Right.
like Taiwan or Singapore or Hong Kong.
Hmm.
They actually have vending machines that has masks in them.
Wow.
You can walk up to a vending machine, put in whatever amount, and get yourself a mask,
Hmm.
because it's everyone believes that mask saves lives. Why don't we have masks in vending machines? Just I mean, we have cookies, cakes, sodas, and food that kills you.
Hmm.
Why don't we have something that saves you in
Boy,
a
there you
vending
go.
machine?
There's a business opportunity. Mask
This is
vending
an
machines.
opportunity.
All
Right?
right, so let's talk about some other positive things here. So we've talked about we're all scared and we're confused, right? And I think that's the general consensus here. We're still scared. I thought this was going to be over with. I thought let me finish on that thought. One other thing. I thought summer was going to kill this thing. It's supposed to die in the heat. What's going on?
I guess summer isn't going to kill it because it's exploding now.
Yeah.
Uh,
That's a
so
that's a big shock. That we were all counting on that. Okay, summer's coming. I think President said that a couple times. Others have said that. I
I
believe
was
that.
counting on that. I was hoping on that as well. And
Some
so
the
this is
heat ain't
just proof.
killing it.
No, obviously not. This is just proof that this is a new virus that we're learning about.
All right, so
And
let's talk about positive things here. Wearing a mask. I think in stores have done a fantastic job with this, and I think it's partly because they want to look responsible, partly
mhm.
because they want to protect. They want make people feel safe coming into the store, and partly because they want to protect their employees. Partly because they care about them, partly because they don't want to get sued. I'm sorry to say it.
And
Yeah,
partly because they don't want to close.
and they don't want to close, so they'll do everything they can to try and
Have,
make this. So
have you seen a list of restaurants that have closed down simply because their employees were diagnosed with it?
yes.
And they had to just close down the restaurant and do a
Oh,
deep
that's a
cleaning
good
for
point too,
several days.
right? So if you find suddenly, if 20 of your employees got it, you got to shut down and do a
You
deep
got to
cleaning.
shut down. right?
So
And
for all
so
those reasons, I see somebody's here on your Facebook page says she has a retail store and they go out of their way to accommodate people. And if you say I'm not going to wear it or I can't wear it or whatever, they'll try and come up with other alternatives. I'd love to hear what some of those other alternatives are. Because I think the more that stores have somehow gotten us to comply. We want to shop and they want to
right,
be open. So we grumble about it, but we by and large wear a mask in retail stores. That's the one place I see, even though they're not forcing you to, a
right.
few of them are saying you must wear a mask or please wear a mask or can we help you wear a mask. There's a lot of urging and pushing you to do that. One or two I've seen have actually said you got to, and if you don't want to, sorry, come back another day or we'll try and come up with some other alternative for you here.
Yeah, what are the alternatives?
What are the alternatives? That's what I'm saying.
So the alternatives could be like a bandana, like anything that covers your face, right? Would be an alternative. If you don't have like a mask, a bandana, some type of cloth covering, maybe a face shield, Stacy. Maybe a face shield would be another option for those who can't wear a mask for one reason or another.
because that gives you a lot more. It's not as tight to your
Yeah,
face or
yeah,
it's
it's
further out.
better, right? It's at least it's some protection versus no protection.
Well,
Uh,
so I think let's come up with here's my list of a couple quick ideas here of
yeah,
things you can do. One, I love Sherry's idea here. Sherry, you get 5 gold stars today here of carrying extra masks so that you just simply, if you see somebody, do you need a mask? Hey, I've
I
got an
love it.
extra one if you need one here, and then you're just sort of saying it'd be nice if you were wearing a mask and without calling them out, without saying, where's your mask or put a mask on. And then we're confronting each other here. And people say, oh,
Right.
I can't wear one. I didn't forget it. I'm sorry or whatever. It would be a positive gesture rather than a negative gesture. Another thing is, and we're going to talk about this at 1 o'clock here today, if you want to join us for that other discussion, can't we make masks fun? I am completely
Mask fun.
wrong. I thought masks would be like Halloween. Everybody loves to wear a costume on Halloween. We love to dress our face up. Everybody at
Put
the
your
bank,
brand on there. Put
put
your
your
brand on there.
brand on
Put
there,
your
put some
logo.
funny character on there. Can't we make, I thought celebrities would be wearing masks. You'd see
Yeah.
whoever your favorite celebrity is. Brad Pitt would have a goofy one here or something, and we'd have our political statements on here. Make America great. Wear a mask again. We'd have everything. I thought this would be a branding opportunity for
Yeah.
companies. Coca-Cola would be handing out
Right.
free masks that say some funny thing. Why can't we make mask wearing fun? Why does it have to be onerous and awful and
Yes,
evil?
yes, yes.
So I think we should be
No.
finding ways. We're trying to do that here at OC Talk Radio. We're thinking about making a fun mask. And would anybody wear it if we gave it out? Is that a good idea? Should companies be
Yeah.
trying to
Hey,
make fun
guys,
masks?
who would want an OC Talk Radio mask?
Yeah, right.
Tell us on the
Seriously, we'll make some if we can come up with if people
yeah,
want
tell us
them.
on Facebook if you want an OC Talk Radio mask,
Yeah,
or maybe a tongue out mask, or the Walking Dead mask.
yeah, or a Health Talks mask, a Dr. Trinh mask or something here. I don't care. Would you wear something that funny, that silly, that said something, had a big speech bubble on it and said, where masks save lives or something here.
So Isabel has a good point here in her comment, and she's saying there was a comment against mask, and one of the comment against mask is that masks are for criminals.
Ah, yeah, we've had stores that have said that. In the beginning, somebody would walk in with a mask, they thought, we're getting robbed.
That masks are for criminals, and
But think
so
about it.
my
Superheroes all wear masks. Batman wears a mask to hide himself. The Lone Ranger, the president said the other day, wears them. Who is that masked man? The mask can be also for good.
yeah. So how do you counter that? My counter to that is that we need to educate, and we need to let folks know that masks will save your life and the life of your loved ones.
So would you all wear a mask that simply
Yeah.
said, masks save lives?
Ooh. That's a good one. Mass saved lives.
We would all walk around and we would just polite. I'm just telling you my point of view here right now. Maybe it's my statement to the world. Mass save lives.
Stacy says she'll wear a mask with Dr. Trin on it. Funny.
Dr. Trinh, yeah, right.
Sherry Ross, mask with a big smile. But by the way, any of you guys who are going on my 9 a.m. Zoom chat this morning, can you post the Zoom link so I can figure out which the link is that I need to go into my own talk at 9 a.m.?
Dr. Trinh, come
You
on.
post the Zoom link for me.
Okay.
But guys, here's something that has been worrying me the last few days that I want you to take notice. Last few days.
Okay, where you
We're
got?
in July,
Yes.
and October is coming. So the question is, what's going on in October, right? What's going on in October is that usually around October, the yearly flu virus comes on.
Mm-hmm. Is that because of seasonal changes? I used to get sinus infections always
Weather
in.
changes, right? So starting around October, we are going to have the flu and we're going to have COVID. That worries me.
Mm-hmm.
Because no one is going to know who has what.
Yes, you got the runny nose, the cough. Have I just got the seasonal flu or have I got the COVID?
No one is going to know who has what. Or do you have a cold? Do you have the flu? Do you have COVID? That worries me a little bit, because it's going to be a mess if we don't get this under control now.
Mm-hmm.
We have between now and October to try to bend that COVID curve back down.
Mm-hmm.
Right?
And to your point,
October.
there's only so many hospital beds, and there's certainly even fewer ICU beds, intensive care unit beds. Some of those are going to be taken up with flu patients. We're going to have even more demand on the system.
Double whammy. Double whammy is what Isabel says. Isabel, thank you for the link. I'm going to use that link to log in later at 9. By the way, Isabel, what are we talking about today? Can you remind me? My memory's so bad about. Anyway, but yes, October is coming. We have until October, guys, to try to bend this COVID curve back down. And we did it successfully in the last few months. Right?
Yeah, we've shown we can do it.
It's going down the last few. We know we can do it. We did it. And now it's like this. Because, because of all the reasons we talked about. We have a few months, guys, because if we don't bend this curve back down and October comes, you're not going to know if you have the flu or if you have COVID. Mm-hmm. We're going to be in trouble, guys.
Mm-hmm. Yeah, we're probably, a huge mess. And I can't imagine. All right, last question for today here as we get ready to wrap up. This is the question of the day that I think is on many of our minds. Having shut down once, will we ever shut down again?
Well, our governor is shutting down again sit-in restaurants at a number of counties. He made that announcement yesterday.
Mm-hmm. But so I've had more people, I've asked that question just anecdotally. Maybe it's business types that we talk to here on OC Talk Radio, and they're like, hell no. They're not getting me to do that again. Hell no. I did it once, reluctantly, fearfully, but we ain't shutting the whole country down. We're not giving everybody $1 trillion in checks again to cover you through this. Heck no. I don't know that most of us will willingly go into the shelter in place again here without more violent protests or angry people. Yeah. We'll have to enforce it more. I mean, they weren't running around giving everybody fines. We willingly said, okay, we'll do it and we'll stay home. I don't like it. It's going to hurt my business. Nothing's good. Are they going to have to force us?
I was driving to the hospital today this morning and to see some patients. And on the radio, I heard that somewhere in LA or Hollywood, they are going to fine $300 if you're out in public without a mask. Mm-hmm. It's a $300 fine. So yeah, it's that kind of stuff is coming unless we take care of ourselves.
Governor
And
Newsom was
do the right
suggesting that they're going to put more enforcement and teeth into this thing here. If restaurants or stores are defying it and saying the heck with it, they're going to start threatening their liquor licenses. They're going to start fining
right.
them. They're going to do. They have other, things they can pressure them with, and it may get to the point where cops are running around the street ticketing people for doing this. I don't know what kind of world we could live in. I mean,
It's
again, if
scary.
enough people say screw it, you can't fine everybody. You can't jail everybody here. That's the problem with the I love people who say, well, all the protesters went on the street, so therefore I can go do whatever I want. Well, no, there was a rage that erupted over some videos and some cases, and people took to the streets. I wish they hadn't done that, and without the masks and all the other stuff, people get angry, but we couldn't stop them. Not without intensifying the riots, not without shooting people. It's almost like you got to let this out just so we can pull it back in. There are only so many cops in the world. There's only so much violence we're willing to threaten here. So
Right.
people use that as an excuse. They only allowed that to happen because when 10,000 people take the street, then the government says there's nothing we can do. I mean,
Right.
unless you want us to start shooting people, there isn't anything. We either let that run its course and try and control it and bring it back, and so if 10,000 people take the streets and say I'm not going to wear a mask, then you win.
Yeah.
We've
Yeah.
overwhelmed the
You
system.
can do. Vivian says, what about elective surgeries?
Yeah, sure.
It,
Forget it.
so Vivian, it really depends on the hospital, and it really depends on access and availability of hospital beds and surgical beds. If if our hospitals have hospital beds and availability for elective surgery, I'm sure they'll probably continue that. When it gets really tight and patients are and the hospitals are full, that's when I fear that they may take stuff away like elective surgery. So it depends on access to the hospital beds.
And what if you hit in a
And
car crash? What if you have a heart attack? What if you have a stroke? There's a million other regular uses for those ICU beds and for those hospital beds. And if they're all filled up, if we have no room at the inn, to use a biblical reference here, then people are going to be turned away and sleeping in the stables.
it's scary. All
Well,
right.
on that note, we're all let's double down. Let's find ways to make this fun. Let's turn this into a positive thing. Let's offer free masks. Let's find a way to turn this around before we have to make it even scarier. Thanks so much for joining us today.
Take care. See you guys later in a few minutes on Zoom.
And again, come back at 1:00. You can come to the OC Talk Radio YouTube channel. You can come to the OC Talk Radio Facebook page. You can go to the Rad Life. We're going to delve into the past and talk deep about 1918 and what, if anything, that can teach us to what might be coming ahead. Some interesting examples coming up on our next show this afternoon at 1:00 here on the OC Talk Radio. Once again, you've been listening to Health Talks, a healthy examination of what's really hurting us here today. Our fears, our phobias, our fantasies. Let's try and find fact from fiction. Join us each and every Thursday for Health Talks here on Orange County's only community radio station, octalkradio.net.
Very scary, isn't it?